It is being called a threat to the public healthcare system. A new report suggesting the Ford government's plan to reduce surgical wait times will actually increase them.
We talk about the threat of U.S.-style healthcare. The threat is real.
The report by the Canadian Centre for Policy Alternatives, dubbed At What Cost, dives into the Ford government's Bill 60, which would allow more OHIP-covered procedures like cataract surgeries, MRI and CT scans, and knee and hip replacements to take place at private, for-profit clinics.
Ontario does not lack the physical space and equipment to improve wait times for surgeries and medical imaging. What we see is we lack the necessary staff to be able to do the work.
The report found Ontario already had the best wait times for joint replacements and scans in Canada, performing substantially better than provinces like Alberta, which are outsourcing those surgeries.
To be clear, wait times remain too long for Ontario patients, but the sensible approach is to properly fund and improve the public system, not destabilize it.
Ontario's Attorney General estimating that 34% of hospitals have unused OR capacity, the report recommending taking advantage of that unused space instead of moving surgeries outside of hospitals, staffing them.
We know that the private for-profit surgical centers are going to siphon healthcare workers out of the publicly funded system, creating increased wait times. If procedures and surgeries are to come out of hospitals, it should be done in a manner that is entirely not-for-profit, with strong protections in place.
To me, it's not an either-or. We've done both, and we will continue to do both because we really want to make sure that people who are sitting on wait lists right now get an opportunity in community as quickly as possible.
The government stressing the procedures will remain covered under OHIP, but the report highlighting a lack of oversight, raising concerns about upselling and the quality of care.
These are the same physicians, doctors, anesthetists who are practicing in our hospital system.
Are you concerned, though, that this will worsen the staffing shortage, Minister? We couldn't get an answer on that, but opposition leaders say this was never about reducing wait times.
This has only and will only ever be about this government's commitment to padding the pockets of shareholders of these private corporations.
Yazdani, City News.